Hi, my name is Ma'am,
My name is Hunter.
and today we will talk about the nanoparticles in dermatologic surgery.
We chose silver nanoparticles. The shape of the silver nanoparticles can be described as quasi-spherical, and the size is about 4.8 nanometers on average. The nanoparticle objects can bring a significant amount of improvement in the antibacterial activity through this element through specific effects such as the absorption at the bacterial surfaces. The image to the left shows some of these effects happening. It is an image of a silver nanoparticle and all the antibacterial activities with other elements happening at the surface.
And for the application of the silver nanoparticles, silver nanoparticles are being used in wound dressing and tissue adhesives to help with decreased healing times and to reduce the amount of infections. One issue with the current ionic compounds are the cytotoxicity to surrounding cells. Nanoparticles avoid this issue by allowing a slow and more controlled release of drugs at the wound site. The silver antimicrobial effects of the silver nanoparticles reduce infections and allow wounds to heal quicker. This this application is important to society because it can decrease the mortality rates and the recovery periods.
What exactly did silver nanoparticles do? Silver nanoparticles have been shown to be effective at nanobridging. The silver nanoparticle formulations provide more rapid and efficient skin closure compared to sutures or mesoporous silica nanoparticles. This new discovery will mark the beginning of nanoadhesives and aesthetic wound healing, which reduces scars of minor abrasions and cuts. It also raises a possibility that the tissue adhesives that contain silver nanoparticles might serve a dual purpose of wound support and prevention of infection. The image to the left shows the silver nanoparticles inside of the wound, keeping bacteria and other viruses from reproducing. It also helps the skin cells bridge together and heal more efficiently.
So, in conclusion, how does this improve upon the current technology of this application? Well, there's an advantage and disadvantage of it. The advantage is that the products using silver nanoparticles require less frequent charges compared to traditional dressings, which leads to decreased trauma to the wound bed. It also decreases the healing time from an average of 15.8 days to 12.4 days. It leads to significantly fewer infections and shortens hospital stays. In the application of tissue adhesives, it leads to more rapid and effective skin closure compared to the traditional stitches. Nanoparticles will be likely to play an important role in treating wound and then recovering from it. The disadvantage is that this is still in its testing phase and not available for the public yet due to the health concerns. In particular, the unique physical properties of nanoparticles raise concern for possible toxicity. There exists a theoretical risk that systemic exposure may lead to increased adverse interaction with enzymes or other regulatory proteins, or even chromosomal damage and genotoxicity, which leads to cancer. And given the unique biodistribution, pharmacokinetics, metabolism, and degradation of nanoparticles, through investigation will be needed for each translation into clinical practice.
And these are our references. We used info from the article, and these also are our sources for our images in our presentation. And then the silver-based materials have provided the most impressive results and are the only nanoparticle-based dressings to receive FDA approval in the treatment of acute and chronic wounds. But like Lam said, it's still really early in the process, so the FDA is still looking at long-term effects of these products. Thank you for watching our presentation.